Assalamualaikum warahmatullahi wabarakatuh. I am Azri Nazira binti Muhammad Jafar. My number matric is 70-23F1047 and I will be the first presenter for this presentation. What is typhoid fever? It is a serious waterborne disease that caused by Salmonella enterica serotype typhi. This is the example that I will give you. Transmit through food or water contaminated by feces or urine infected people. Next is causes and pathogens. The main causes is it can survive in water and sewage for several weeks. Next is it can transmit to us by ingesting contaminated food or water. Moreover, source of contamination. The first one is improper waste disposal. The second one is poor hygiene by food handlers. And the third one is inadequate water treatment. Next one is the symptoms. The first one is it can develop 6 to 13 days after exposure. The common symptom of this is high fever, which is 39 to 40 degrees Celsius. Second, fatigue, headache, appetite loss. And the third one is abdominal pain, constipation or diarrhea. Fourth one is rose color spot on chest or abdomen. This is the example that I will give you. The effect is for individual is long recovery period. Okay, the second one is risk of life-threatening complication if untreated. For the community impact is school absenteeism, strain on healthcare system. For the environmental impact, it can contaminate sewage, pollutes rivers and groundwater, worsening water quality. This is the key risk factor for this. The first one is lack of clean water and safe drinking water. Second one is poor sanitation and sewage disposal. The third one is contaminated food and poor hygiene. And the third one is limited vaccination and healthcare. However, there will be an impact of this. The first one is for individual and family, which is leads to medical expenses and loss of income. The second one is on community and nation. It is can impact education, tourism and agriculture sector. This is the effective points to target or for prevention and control. The first one is reservoir control, which is we can identify and treat carriers early with antibiotic. The second one, the portal of exit, which is proper disposal and treatment of human waste. The third one is mode of transmission. We can ensure safe water supply, effective sewage treatment, and promote hand hygiene. The fourth one is portal of entry. We can promote boiling and filtering of drinking water and proper food hygiene. The last one is susceptible host protection, which is vaccination programs and health education. So there are two transmissions, which is direct and indirect. What is direct? I will give you an example, which is handler preparing meals without hand washing. Okay, for indirect transmission is drinking water from sewage, contaminated source. So we can conclude that indirect is from sewage and then water or food and then human. This is the main cause of or the dominant cause of typhoid epidemics.
My name is Fatinur Kamilia binti Kamarudin, 17-23F1011.
The number of typhoid fever cases in Klang Valley fluctuated from 2011 to 2015. The highest reported cases occurred in 2015 with 117 cases and an estimated incidence rate of 1.42 per 100,000 population. The increase may be linked to poor sanitation and water contamination during that year. Although the cases slightly vary each year, the data shows that typhoid remains a persistent health issue in the region. The most affected age group was 21 to 30 years, representing 27.6% of total cases. This indicates that young adults are more exposed, possibly due to eating out frequently or being active in public areas. Children from 0 to 10 years and teenagers from 11 to 20 years also show significant infection rates, highlighting the need for hygiene education in schools and communities. As we can see from the study area, typhoid fever was most widespread in Gombak with 82.9%, followed by Hulu Langat 66% and Wilayah Persekutuan Kuala Lumpur 65.5%. These areas may have had denser populations, poor waste disposal or issues with food hygiene. In contrast, Klang 22% recorded the lowest cases, which could suggest better sanitation or stronger local health measures. The first one is social effects. Typhoid fever greatly affects social life by limiting interactions within the community due to isolation and quarantine measures. Fear of infection causes people to lose trust in local food stalls and restaurants, especially those suspected of poor hygiene. Communities in affected areas may experience social stigma, but the outbreak also increases public awareness about cleanliness and safe food handling. The second one is environmental effects. The outbreak of typhoid fever reflects problems in sanitation and water quality. It shows that some areas still lack proper waste disposal and clean water system. This situation encourages authorities and residents to improve sanitation facilities, protect water sources from contaminations, and practice better environmental hygiene. Next, economic effects. Typhoid fever creates an economic burden for both the government and the public. The government must spend more on healthcare, vaccination and control programs, while business such as food stalls, markets and tourism sectors experience losses due to public fear. Infected individuals may also lose income during recovery, showing how the disease impacts both national and household economy. Then, for health effects, the disease affects the digestive systems and causes symptoms such as high fever, stomach pain, weakness, diarrhea, and dehydration. It is especially dangerous for children and people with low immunity. Without early treatment, it can lead to serious complications and even death, highlighting the importance of vaccination, hygiene, and access to clean water. And for safety effects, typhoid fever highlights the importance of maintaining food and water safety at all times. Food handlers need to follow proper hygiene practice, including washing hands and using clean utensils. Regular inspections by health authorities are important to ensure safe food preparation and prevent further disease transmission. Last but not least, the legal and cultural aspects. Legally, the outbreak encouraged stricter enforcement of hygiene and food safety laws. Businesses that fail to follow health regulations can face fines or closure. From a cultural perspective, health education plays an important role in shaping public behavior. Teaching the community about sanitation, clean food preparation, and safe water usage helps reduce infection risks and promotes a healthier lifestyle.
My name is Nudamia Kaisara Bitina Yazid. My matrix number is 17-23F1066. The evaluation of mitigation and intervention strategies for typhoid fever highlights several key approaches. One of the most effective methods is the typhoid conjugate vaccine (TCV), which provides long-lasting immunity and is recommended by the World Health Organization (WHO) for children and high-risk population. Countries such as Pakistan and India have successfully reduced typhoid cases to national vaccination campaign. Although challenges like high rural vaccine costs, limited rural access, and low awareness still exist. Improving sanitation and water supply is another crucial strategy. Safe drinking water and proper sewage system help prevent the spread of Salmonella typhi, the bacteria responsible for typhoid fever. The installation of water treatment facility and repair of all pipeline can reduce contamination risk. In Malaysia, improved sanitation system and regular water monitoring have helped lower the risk of outbreak. Though continuous maintenance and government support are essential for sustainability. Public awareness and hygiene education also play a vital role. Educating community about hand washing, proper food handling and personal hygiene effectively reduce the chance of infection. Awareness program in school and local community are cost effective and encourage long-term behavioral change, but they require consistent reinforcement. Additionally, street food safety and health regulation are needed to control the spread of typhoid. Regular inspection of street food, vendor, restaurant and market ensure that food is prepared in hygienic condition, while proper waste management prevent contamination. For long-term sustainability, combining all these strategies like vaccination, improved sanitation, hygiene education and food safety create a strong and comprehensive approach to controlling typhoid fever. Vaccination offers immediate protection, while sanitation improvement and education provide lasting prevention against future outbreaks.
We have 3 levels of disease. First, primary prevention. So first, for the primary prevention, we must improve water quality and sanitation. This means providing safe, treated and clean water for the community and ensuring proper sewage system so human waste does not contaminate water sources. Typhoid spread through Salmonella typhi bacteria found in feces of infected people, so clean water and proper waste management prevent the bacteria from spreading. Second, promote hygiene education. Teach people to wash hands with soap before eating, preparing food and after using the toilet. Good personal hygiene stop bacteria from entering the body through contaminated hands or food. Third, food safety measures. Encourage people to boil drinking water, cook food thoroughly and avoid raw or street food prepared in dirty conditions. This kill bacteria and reduce the risk of infection. Fourth, vaccination. Giving typhoid vaccine people in high-risk area like place with poor sanitation or frequent outbreaks help build immunity and lowers the number of cases. Secondary prevention. First, screening and diagnosis. Regular health checkups and lab tests like the Widder test or blood culture can detect typhoid early. Early diagnosis means treatment start quickly before the disease becomes severe. Second, prompt antibiotic treatment. Giving the right antibiotics immediately after diagnosis kills the bacteria and prevent it from spreading to others. It also prevents serious complications like intestinal bleeding. Third, surveillance system. Health departments can set up disease monitoring programs to quickly identify new cases or outbreaks. Yearly detection of an outbreak help authorities take fast action like improving sanitation or giving vaccine. For the tertiary prevention, first, medical management and rehabilitation. Patients with severe typhoid need hospital treatment, fluid replacement and nutritional support to recover. This helps prevent complications such as dehydration or organ failure. Second, public health follow-up. After recovery, health workers monitor patients to ensure they are fully cured and not still carrying the bacteria. This prevents relapse or reinfection and protect others from getting infected. Third, antibiotic stewardship. Doctors should give the correct antibiotics in the right dose to prevent bacteria from becoming resistant. Antibiotic resistance make future treatment more difficult and dangerous. For the comprehensive public health approach, first, integration of primary, secondary and tertiary prevention. For the primary prevention, stop Salmonella typhi from spreading by ensuring clean water, good sanitation, hygiene, education and vaccination. Secondary preventions control the infection early through quick diagnosed treatment and monitoring to prevent outbreaks. For the tertiary prevention, focus on full recovery of infected people, preventing long-term health issue and reinfection. So, for the interconnection between the 3 levels, these 3 levels are interdependent. Without clean water, primary, there will be more cases to detect secondary and treat tertiary. Strong surveillance system, secondary, provide data to improve sanitation programs primary. Proper treatment and antibiotic control, tertiary, reduce resistant strains that could re-enter water sources affecting primary prevention. Together, they create a loop of continuous protection, preventing new cases, controlling existing ones, and ensuring full recovery and system management. For the public health collaboration, a comprehensive approach also requires collaboration between multiple sectors like health authorities, environmental agency, water treatment service, education sector, and the public. This team will ensure that clean water system, health education, vaccination campaign, and medical service all function effectively together. For the community participation, community involvement is crucial. People must understand hygiene practice, vaccination important, and their need for early treatment. When the public actively participate, disease prevention becomes more sustainable and long-lasting. Learn in implementation for the typhoid fever. First, limited access to clean water and sanitation. Many rural or urban poor communities still rely on untreated water sources such as wells, rivers, and rainwater. Without proper sanitation system, human waste can contaminate water and spread Salmonella typhi easily. Building water treatment facilities require high costs and government support which are not always available. Second, weak healthcare infrastructure. Lack of hospital, clinics or diagnostic laboratories make it difficult to detect and treat typhoid yearly. In remote areas, there may be shortage of trained health workers and limited access to antibiotics, causing delays in treatment. Then, vaccine hesitancy and limited coverage. Some communities do not trust vaccine due to misinformation, culture, belief or fear of side effect. This results in low vaccination rates, leaving population vulnerable to outbreaks. For the public awareness and behavior, people may not consistently practice good hygiene such as hand washing or boiling water due to lack of knowledge or habit. Education campaign require time and funding, and behavior change can be slow. Lastly, antibiotic resistance. Overuse or misuse of antibiotics had led to drug-resistant Salmonella typhi strain. This made treatment less effective and increased the cost and duration of recovery. The conclusion is typhoid fever is a serious waterborne disease that mainly affects people in areas without clean water and good sanitation. It is caused by Salmonella typhi, a bacterium that spreads through food or water contaminated with the feces of infected people. Once inside the body, it causes long fever, tiredness, stomach pain, and can lead to severe health problems if not treated. The spread of typhoid is closely linked to poor hygiene and unclean environment. In many places, unsafe water, poor water disposal, and weak sewage system allow the disease to keep spreading. To prevent typhoid, it is important to improve water quality, teach hygiene practice, promote hand washing, and ensure proper disposal of human waste.